All right, I think we're at time. Dave?
Okay. Hello, everyone. This is Dave Jacobs. I'm the Chief Scientist at the National Center for Healthy Housing. Welcome to our webinar. We've been threatening this for a while now. I think we'll wait a few more minutes. I see a number of people are still logging in. The session will be recorded, so if you're not able to get to it now, the recording will make that available after the project, after the listening session. So we'll just wait a few more minutes. So be patient with us. Initially, everybody will be on mute. We expect the presentation to go for about 30 minutes. Then we'll have 15 minutes for questions and answers. And then we have, for the last 15 minutes, we'll be discussing some recent developments on the appropriations front that should be of interest to everybody in the National Safe and Healthy Housing Coalition. I know that in the past we've usually gone around the room, but we have looks like about 50 attendees so far, and more coming in. So we'll just wait for another couple minutes. Maybe we should just use a couple minutes. Gabriella, you're there?
I am.
And Mary Jean Brown, you're there?
I am.
Good. Okay. And Sarah, you're there as well, right?
Yes, I am.
Great. Okay. Well, why don't we go ahead and get started? By way of an introduction, we have two speakers with us today. Gabriella Ija is an associate with the Health Impact Assessment Project at the Pew Charitable Trusts. She was one of the principal leaders in development of the report we're about to discuss today. And Dr. Mary Jean Brown is the former director of the CDC Lead Poisoning Prevention Branch. I think many of you on the call know of her. But she's been a long time scientist and advocate and researcher and leader in the childhood lead poisoning prevention movement. This report, in my view, is the major report, the first one to really appear since the year 2000, 17 years ago. It does lots of things, but I think it's worthy for everyone on the call here to take a good hard look at it, understand what it says, and then we'll talk a little bit about how we expect to be using it going forward in our research, science, and advocacy work. So without further ado, let me turn it over to Gabriella and Mary Jean.
Great, thank you, Dave. So hello, everyone, and thank you for joining us today as we discuss our recently released report, 10 Policies to Prevent and Respond to Childhood Lead Exposure. As Dave said, I'm Gabriella Ija, and I had the honor of working on this report over the course of the last year. To start, a quick primer on the Health Impact Project. We are a collaboration of the Robert Wood Johnson Foundation and the Pew Charitable Trusts. In light of the crises in Flint, Michigan, and East Chicago, and other sobering news reports across the country, it became increasingly apparent, as you all know, that lead is not a problem of the past, but rather a pressing public health issue in need of action. It also became apparent that policymakers could benefit from having a set of timely, evidence-informed, cost-effective policies to help them respond to risks in their communities and also prevent future crises from taking place. So that sets some of the context for our report and how we got into this. And I think it's also worth mentioning that a grounding belief in this effort is that the find it, fix it approach to lead doesn't work. But really, primary prevention is what we need to lean on to prevent lead-related disabilities. Let's see if I can get this thing moving. Here we go. So our efforts began in August of 2016 with the convening of experts in our office to discuss the state of lead exposure as we knew it and the interventions that had proven successful thus far. And that was a great starting point, but we needed to delve deeper. So with help from partners in the field, the research team developed a list of more than 100 policies for analysis. We also screened policies based on key informant interviews, focus groups, and a series of group meetings with experts, advocates, parents, and community members. We used 2 models to estimate the long-term impacts of lead on children's lives. The Urban Institute's social genome model examines how factors at a single life stage, in this case early childhood, can cascade through a person's lifetime. So if a child is harmed by lead as a toddler, the SGM can calculate the effects that his or her reading and math scores and behavior would be affected, and how these outcomes would later affect things like graduation rates, criminal convictions, and teen pregnancy. The second model we used was Altarum's value of prevention tool, which helped us quantify the impacts of 4 lead exposure prevention policies: lead water service line replacement, lead paint hazard control, enforcement of lead safety requirements when renovating, repairing, or repainting painted surfaces, and removal of lead from aviation gas. The models looked at the impact of the prevention approaches on the IQs of children, and from there it estimates changes in lifetime earnings. Additionally, the VP tool calculates the savings in government spending for health and social services. And Mary G. Brown is going to talk a little bit more about the findings from those models a little bit later in the presentation. We also engaged experts to review our findings and to make recommendations. The experts helped ensure our analysis and policies were not only sound, but also feasible. We also consulted professionals from an array of fields, including environmental and public health, child development, economics, housing, healthcare, environmental and social justice, and drinking water engineering. And I'd also like to note that our experts and advisors were an active group throughout this project. They participated in regular webinars and conference calls, line edited our report, shared relevant information and insights with us all along. So I do want to take a moment of gratitude for these folks, some of who I'm pretty sure are on the line right now, because I think that collaboration really strengthened our work, and I think the report reflects the power of those partnerships as well. And the report was funded by the Robert Wood Johnson Foundation with additional support from the Charles Stewart Mott Foundation. So moving on, I would like to highlight a few takeaways from the community conversations we had during the project. First, and I really don't think I can stress this particular takeaway enough, place really matters. For example, in California, parents and environmental justice advocates were really worried about air and soil contamination because they'd experienced significant issues with a lead acid battery recycling plant in the area. Whereas in Flint, folks were understandably concerned most with lead in their water due to the ongoing crisis. And in Philadelphia, for example, we heard community members concerned with the demolition of old buildings and the lead risks associated with economic development. So I went back to this idea that place matters quite a bit during the project, because at times I'd find myself in a position when decision makers wanted to ask for a one-size-fits-all approach to lead, and I'd turn around and have to ask, you know, what community they were really trying to affect change in, just because there was so much variation. As for the barriers that surfaced during our focus groups, I think this group knows of these all too well, right? You know, the financing these interventions is a huge barrier for folks, in addition to a lack of awareness and public services available on the ground. And what was somewhat surprising to me, although in hindsight it probably shouldn't have been, was this idea that there wasn't always good trust in government at the community level. So having to overcome that in order to be successful when implementing these policies was certainly going to be necessary for their success. And when we asked folks what should be done to address lead, over and over again, we heard awareness. Parents and landlords, you know, said that if they had known the risks, they would have tried to protect children in advance. And they repeatedly said that if financial resources for remediation were readily available, that getting the lead out would be a no-brainer. All right, so moving on, next we have Mary Jean Brown, who's going to talk about some of the results of our modeling and the recommendations that stemmed from our findings. Mary Jean?
Thank you, Gabby. So we kind of developed an alternate reality here because we know that total prevention of childhood lead poison is impossible, at least in the foreseeable future. But we did model the economic impact of keeping children's blood lead levels at 0 as a bounding exercise so that we could better understand the maximum potential benefits from these preventive policies. We also, because there are more children with blood lead levels between 2 and 4 micrograms per deciliter compared to greater than or equal to 5 at the population level, of course the models found most benefits accrued to this group that have, by historic standards, fairly low blood lead levels. The savings were generated by improving the children's future earning capacity, and as well as savings to care and children, to savings in the cost of care for children with high blood lead levels in terms of medical care, special education, and juvenile justice costs. We and our expert panel are not recommending or prioritizing any strategy. As Gabby said, local conditions require locally tailored responses. But in general, these strategies will bring the most benefit for U.S. children. And as you can see, we are expecting there to be about $3 billion in savings for children with blood lead levels 10 or higher, another $4 billion for kids with blood lead levels between 5 and 10, another $17 billion for kids between 2 and 5, and then finally $60 billion for kids whose blood lead levels never go higher than 2. So the strategies that we found most important are, well, I guess first I should say this is for the 2018 birth cohort. So these savings are for the children who are born in 1 year. We expect that at least in the very close out years like 2019 or 2020, there would be very savings that are very similar to these would be achieved. But over the longer term, we couldn't really expect that this would just continue to be these kinds of savings for the next 40 years or something. So we focused on homes built before 1986, and the findings that you see in front of you now in terms of the water. Oh, Gabby, I'm sorry. Yeah, removing lead from drinking water service lines in the homes of children would protect more than 350,000 children and yield the benefits you see as above. So we were focused on housing built before 1986. The estimate is derived from recently proposed modeling done by the IEUBK model that suggests a 0.042 microgram per deciliter increase in blood lead levels for every 1 part per billion increase in water lead levels. We assumed that water lead levels would decrease to about 2 parts per billion, and that 2 parts per billion would be the contribution of the remaining lead. So we're just talking about taking lead service lines out, but we know there's other lead plumbing fixtures in the homes. Lead fixtures weren't completely banned until 2014, and for the 10 previous years before that, things that said they were lead-free could be up to 8% lead. So we also thought that there were some things that should be done, some tactics that we could use that would help to achieve this. And the first one is that the EPA should provide funding to train water system personnel to improve the consistency and effectiveness of corrosion control across systems of different sizes. So because of the prevalence of lead service lines, but not only because of that, we need to make sure that that optimal corrosion control is achieved in the United States. And that's so that the lead service lines, until they can be replaced, are protected, and also so that the remaining lead in the interior plumbing does not leach into water. So we're going to have to use corrosion control for a very long time. We think that municipalities should require developers to replace lead service lines when they are doing residential property development. So if you're going to do infilling property development or something else, where you're going to an old neighborhood and you replace buildings, houses in those neighborhoods, you should take out the lead service lines at that time. And we also think that EPA should develop a health-based action level for drinking water in homes and require utilities to test all consumer taps using sampling methods that reveal health risks. And that's really easy to say, but it's very, very difficult to accomplish that. And I think that we acknowledge in the report that coming up with a health-based standard for water and coming up with some pragmatic water testing strategy that could be adopted by lead inspectors or water service people is also quite a difficult task. Next slide. So we also talked about eradicating lead paint hazards from older housing, but only quantified the benefits of doing that for low-income children, which would provide about 3.5 billion future benefits, or approximately $1.39 per dollar invested, and protect more than 300,000 children. So we want to focus the efforts on low-income housing and for children under 6. So any benefits that would come to more affluent children from this strategy would have not, over and above the savings that are estimated here. Next slide. We also looked at the benefits of fully adopting the RRP rule in housing. And this is actually the strategy that returns the most savings. We want to ensure that contractors comply with the EPA's rule, and that would protect about 211,000 children, providing future benefits of $45 billion, or about $3 return on every dollar spent. Now, that's because it's such a cheap thing to do, right? So that it gets a lot of bang for the buck, and we really encourage people to do that. We'd like to see many more states be able to do their own certification. We would also like to see code enforcement and whatever department in the city issues building permits to be linked to the certification process for the contractors. Next slide. Aviation fuel, the small planes, piston aircraft still use lead in their gasoline to avoid piston knock. Certainly nobody on this panel or nobody in our expert group want to see the planes falling out of the sky. But we think that the efforts to remove lead from aviation gasoline can be accelerated, and there are many people in the field who agree with that. That this would protect about 220,000 children who live near these little airports and generate $262 million in future benefits. In addition, it's going to take out about 450 tons of lead from the environment every year, which is not a small amount. And then finally, we talked a lot about, next slide please, providing targeted evidence-based academic and behavioral interventions to the 2 million children in the public schools or in the school systems which with a history of lead exposure. In about, I think it was 2013 or 2014, the CDC came out with a document called Educational Services for Children Affected by Lead. When we admitted in that document, and we admitted in this document, that we don't really have education strategies that we know are the very best way to give educational support to children who've been affected by lead. And we think that research is really important. However, we do have strategies that we know improve education outcomes for children who are in low-income families, many of whom have high blood lead levels. So we think that it's prudent to provide these children with the services that we know how to provide to low-income kids to give them better educational outcomes while we do the research on what is the best way of delivering these. We also think that we need to be a little bit more sophisticated about neuropsychological assessments because many of the disabilities that are associated with lead are executive function. So the very highest level of brain activity, and they can't be found on some of the tools that are currently in use. So we need people to test executive function. We had some other recommendations. Next slide, please. And those include reduced lead in food and consumer products, cleaning up contaminated soil. So, these are, in some populations, subpopulations in the United States, the new arrivals, for example, lead in food and consumer products can have a big impact on a small number of people. We didn't attempt to quantify those impacts. And, there's another way to think about this too, and that's, how dumb was that? We don't need to put lead in bread wrappers or in kids' lunch boxes. We can probably do a better job and not cost a lot of money. We need to improve blood lead testing among children at high risk for exposure and find and remediate the sources of their exposure. We need to improve public access to local data. As Gabby said, the parent groups particularly that we talked to were adamant that they need to have the local data so that they can advocate for their own children, for the children in their communities, so that they can show up at their city councilman's office or their state representative or their congressman's office with data. And we need that data to be packaged in ways that it is accessible to various audiences. So it doesn't do any good to come into a congressman's office with data at the county level. You really need to give the congressman data within his own district. So trying to get a little bit more sophisticated and tactical about how we package this data would go a long way. And then we need to fill the gaps in research to better target state and local prevention and response efforts. Next slide, please. There are some future efforts that that this team will try to go for. I mean, we have this report which offers tangible solutions for policymakers with specific strategies and illustrated by case studies. So one of the great things about this report is that you can go and if you're interested in some kind of an intervention, you can probably find an example, and that example will tell you what people did to be successful. It will also, in many cases, tell you how they got it funded. The advisors to the project strongly recommended conducting similar analyses at state and local levels, or to create templates that state and local partners could use to plug in their own data. This is because of the local nature of childhood lead poisoning in the 21st century. However, the lack of representative survey data at the state and local level does make it very difficult to do this. And we also recognize the budget constraints that many state and local environmental health organizations are well positioned to lead the action agenda. However, that small amounts of funding could be available from the Robert Wood Johnson Foundation or others for convening stakeholders, for some policy analysis, especially at the state or local level, data gathering, presentations to decision makers, and other key tasks that could go a long way to advancing this agenda. The foundation could wrap technical assistance, peer learning, and monitoring around such an effort, similar to their activities in a program called Invest Health. So we understand that a national campaign, and I think we're prepared to move forward on a national campaign to help get these policies in place. And I'm going to stop now and see if there are any questions. Next slide, please.
Let me just kick this off by putting a question forward that a reporter recently asked me. This is Dave Jacobs. He said, what good is another report? We've had lots of lead reports in the past. What makes this one so important? And I'd highlight a couple of things. This report uses the most recent data. The cost-benefit analyses, therefore, are current, and some of you will recognize that these estimates we provided are a little different from earlier studies, which frankly used data from the 1970s, or 1990s rather, for the most part. So this is current data. If anything, I think the cost-benefit ratios are an underestimate because they don't count intangibles. They only count 1 year of the cohort, but the cost-benefit ratio is positive. And so one thing that has always guided the lead poisoning prevention movement is that our evidence and our recommendations are based on good science. And so I think that's what makes this important, this report so important. That's my view. So let's open it up for other questions that people might have.
I'll discuss them those right now, Hannah.
Okay, everybody, you're off.
Flight is at 5:05. Middle of the fourth quarter.
Sarah, I'm wondering if we can help control background noise and triage questions.
Sure. So there's a form to enter a question. So I think there's one question that's one typed in already. Maybe you guys could start with that, and people could type in their questions, and then we could answer them that way, so we don't have to deal with the background noise.
Ian and Dave and I might be able to take it from there.
Sorry, could you repeat that, Les?
Oh, sure. I'm having trouble viewing all of the questions. I do see one, but I think we can answer this one. And then moving forward, would you mind kind of reading off questions, posing them, and then Mary Jean and Dave and I can tackle them after this one? Does that work for you?
Yes, absolutely.
Great. So I see one question here from Kathy asking about what was a specific issue with trust. And I think that's referring to one of the focus group takeaways that I highlighted on one of the slides about trust. And so that's a great question, and frankly, one that I found a bit surprising while we were actually conducting the analysis. A lot of the trust issues stemmed from community groups, from parents, from landlords, stating frustration with particularly, local government agencies that are often kind of underfunded, undercapacitated, not answering phone calls, not being able to readily respond to, reports of lead exposure that had been identified in their homes or in their communities, and a bit of, I think, what we've been hearing kind of at the national level of some, frustration and lack of trust in government as a whole, unfortunately. And so when, we asked folks about ideas for policy solutions, I think some folks were disinclined to really even engage in that kind of conversation because their faith, unfortunately, in their local government agencies at times was had been tested, and the response that I heard a lot was what Mary Jean alluded to, was that folks wanted to be able to gather their own data and to figure out, to be able to participate and kind of take charge to be a part of the solution, figure out what lead looks like in their communities, and then advocate on their own behalves. And so, of course, that's a challenging issue, I think, to overcome in the response effort, but rebuilding trust within community, I think, is going to be absolutely necessary for an effective response. Mary Jean and Dave, did you want to add anything to that? Hello? Sarah?
Mm-hmm.
I'm not hearing anything. I don't know if we've lost Mary Jean and Dave in the process.
I think they may be coming back off of mute quickly. There.
Okay, I'm unmuted now.
I can hear you, Mary Jean.
Okay. So I just wanted to underscore that's probably the finding that we need to get to the government people, that, you know, despite your best efforts, people just don't think government's going to do anything for them. I don't think it's any individual or any organization's fault. I think it's just pervasive through the country. All right. So I can't see any questions.
Oh, I can see a ton, so I can read some of them off for you guys, because there's been a bunch more that have come in. So one question that we've gotten is, a key aspect of the cost-benefit analysis was based on the lifetime economic value of an IQ point, and the question is, what is the source of this economic value assessment?
Corey, are you on the line?
You know, Corey is joining us.
Hi, this is Corey. I'm here.
Can you answer that question?
So, yep, I definitely can answer that question. So we used a mix of studies to determine both the connection between lead exposure and IQ points, and then the relationship between IQ points and downstream earnings. So I can send you a link of, I think it was 3 estimates that were included. They ranged from 1.1% to, I think, 2.5%. And so we used an average of 3 different studies. The relationship, I think, was something like 1.8% was the relationship between an IQ point and downstream earnings.
Thanks, Corey.
Okay, another question that's come in is, Mary Jean Brown mentioned moving forward on a national campaign. Could you say more about what a campaign might look like?
Okay, so this is Mary Jean, and I think that there are the National Center for Healthy Housing and the Health Impact Project together are gearing up for a national campaign that we hope will include bringing people in to visit with their congressional representatives and others. We have asked, and people in the expert panel group have volunteered to put together various op-ed or other kinds of pieces, both for newspapers but also for professional journals. And either Sarah or Gabby, you may have other things that you know about that are going on.
Sure. So in terms of, our effort, we are, happy to get the findings and recommendations out and into the right hands, and are absolutely, supportive of, have been collaborating with partners across the country to do things like, for example, with the National Center for Healthy Housing, having a mini grant competition to support local events on lead prevention and response. And so that's shares a little bit about kind of our broader effort in this endeavor and through this project. And, recommendations certainly involved increasing awareness at the community level in order to take action. And we also have a series of briefs that will be coming out through the Trust for America's Health, closer to Lead Prevention Awareness Week in October. So certainly, a lot of activity and a lot of interest. However, in terms of a formal coordinated campaign, that will not be coming out of the Health Impact Project, but we know that there are existing partners in place already who've, taken on this work and I think are well positioned to move it forward.
Okay, another question is, who would produce the data that you're talking about? For example, would that be community members or experts?
The data that this is Mary Jean, the data that I'm talking about would be the surveillance data that's typically collected at state or local health departments. And those are the data that we need to try to package, interpret. The people who are the custodians of those data should be thinking about how to package and disseminate the data to their best advantage. You know, CDC does have a role here, but it's a couple of degrees of separation between CDC and the actual state and local data, and they don't have a lot of identifying information like addresses that would allow them to do kind of an analysis that all the folks in the focus group were really stressing how important it would be to them to get it. So I know that people have privacy concerns and other concerns that would need to be addressed, but we can't allow those issues to stand between communities and data about the lead risks within their communities.
Okay, I'm just going to keep going with the questions as we go along because there are a ton. So the next question is related to the academic and behavioral interventions. Is the recommendation based on the formal education system that starts in kindergarten, or was the impact of Head Start or early Head Start considered?
We know we have lots and tons of literature that demonstrates that the earlier you start the education, the early intervention, the educational support for children, the better it works, right? So Head Start, early intervention, any of those programs. Nonetheless, we also know that for many children, you're not going to find a disability until you get to the point where the expectations change for the child. So it's okay to have a small vocabulary and a short attention span when you're 2. It's not all right for that to happen when you're 8, right? So first we need to make sure that the early childhood programs are in place and they are funded. So only about 40% of kids who qualify for Head Start ever get it. And those tend to be the 4-year-olds because they want to give them a year of Head Start before they go to kindergarten. We need to make sure that 3-year-olds get Head Start too. But the second thing we need to do is put in systems in place so that when it turns out that Mary is struggling with word problems because she can't make the transition from memorizing arithmetic facts to using math concepts to solve problems, we need to make sure that there's somebody there that picks up on that and gets her the help that she needs and not wait until she's 2 years behind grade level in math. So this is a really systems approach that has to go from the beginning, you know, early in childhood through graduation from high school.
Okay. Another question is, did you do any geographic or demographic analysis of the models?
We did not. We just used national estimates. So the estimate for the prevalence of blood lead levels was based on the National Health and Nutrition Examination Survey, for example. Most of the other data that are in the models also came from national surveys or national studies. We recognize that it'd be really, really great to be able to do this at a much smaller geographic level, but there are not population-based prevalence numbers for the blood lead levels, and that's the barrier to doing this at smaller geographic level.
Okay, the next question is, in the past, efforts have been made to have principles of the RRP rule inserted into the International Building Code rules that are used by local building permit agencies. Why is this effort foundered, and what can be done to the building codes nationwide to recognize lead hazards?
Oh, I think that's a question for Dave Jacobs. Who's conveniently muted. Dave? All right, this is Mary Jean, and I'll just take a stab at it until he hits the right button or they pick him back up. So you're right. Yes, people have tried hard. It's very difficult to get things into the international codes because there are some very powerful actors who don't want to see these sorts of things go into the code. So, you know, the Home Builders Association and the Property Owners Association see this as a burden. And part of that is just a perception that with better education and outreach, we'll probably be able to change, but others are going to require a little bit more work. So I don't think that the folks that have worked so hard in this have given up, but every once in a while they have to take a breath and then start over again.
This is Dave. Can you hear me now?
Yes.
Yeah, finally. Okay. Yeah, the code that's a much longer discussion. Some jurisdictions have been able to do this, but they're rare. And so I think the effort to integrate lead poisoning prevention in the codes is still a task before us. On the local data question, I did want to point out that the center will be producing state-level fact sheets. A few of them are up on our website now, so that's certainly something that people can use. Next question, Sarah, maybe?
Yeah, the next question is, why was 1986 selected for reducing lead in drinking water in homes and 1960 for lead in housing?
Well, because that's when the 1986 is when the lead water laws were passed. The 1960 is used because, you know, it's kind of an integrated thing where there was a lot more lead paint in housing built before 1950, although it wasn't banned for residential use till 1978. So 1960, and I think HUD has done some work on this and found that it's a very sensitive indicator of the number of houses with lead paint hazards in a community.
Okay. The next question is, can you speak to the distribution of effects with respect to low income and urban communities?
I didn't get that, Sarah.
The next question is, can you speak to the distribution of effects with respect to low income and urban communities? And
distribution of effects?
Yeah, and the longer explanation of this question is, a first glance implication of these findings might be to focus resources on RRP enforcement because of the high return on investment. But if we targeted those resources at older, low income neighborhoods, a different strategy might yield a significant reduction in children with blood lead levels over 5. How can we message clearly about these findings and act on them in a way that promotes health equity is the longer question.
Right. So we do devote considerable words, you know, paragraphs on environmental justice and equity as being one of the cornerstones for the, you know, the philosophical underpinnings of this work that we've done. But again, we didn't think that we didn't want to be prioritizing. We see these 4 or 5 strategies as a comprehensive package. So if you live in an affluent community, you know, that was built in 1860, and I live in Connecticut now, so that we have quite a few of them, the RRP rule is probably going to be the one that you want to think about most, right? But if you live in an urban area like downtown New Haven, then maybe you want to find out other ways that you can work with property owners to make sure that rental properties do not contain lead hazards. Again, it's local conditions require local solutions.
I think it's also worth mentioning that if you look at the benefit numbers, Bruce Lanphier has talked about this a lot, but the prevention paradox basically shows that the bulk of the financial benefits actually flow to most children, that is between 0 and 2 micrograms per deciliter. So, you know, it's important, of course, to continue to target our efforts towards, you know, high-risk urban communities and the like. But the fact is that the benefits flow to virtually all children And that's something that maybe we need to think more clearly about as we go forward. Maybe we should take one more question, and then we'll shift to some actually surprisingly good news on the appropriations front.
Sure. All right, so the next question then is the cost benefit just focused on the prevention of lead poisoning, or does it take into account other savings such as replacing windows will save energy, increase property value, create jobs, add to the housing preservation, et cetera?
Corey, you want to take that?
Sure. I think in general, the intangible benefits as far as impacts on the economy are included. So increased productivity and the kind of multiplier effects you get as a result of that are included. Impacts of energy efficiency were not included, nor were impacts of property values. Property values are a little tricky in thinking about what is really the net benefit that occurs as a result of these interventions. Energy efficiency has been shown in previous reports to be very significant when you replace windows. We did not include that in our estimates for the lead hazard control work.
So the report didn't include that, but I think it's probably worth pointing out there was a significant debate about that issue among the team. So at any rate, there are a number of remaining questions. Maybe in a future call we will continue this conversation so that we can hopefully get to more of them. I would note that there are going to be a number of policy briefs coming out on this report, since we know the report is a lot to digest, along with the fact sheets and along with the grantees that were mentioned previously. So there's going to be a process of rolling this out. We encourage you to use the tools that are out there and to continue the discussion, not only amongst ourselves, but also with your decision makers. We hope that this report will once again show that both community support and the underlying scientific research is sound to finally take significant steps to end this problem once and for all.
Gabby, in case people don't have it, could you put the last slide up, because it has the website for getting a copy of the report. Good. There you go.
Yeah, and so we can only really touch the surface here, but I encourage everyone to take a look at the full report. There's a lot of good material in there. Gabby, do you want to have any closing remarks before we turn to the appropriations?
I just want to say thank you for giving us the time to be able to share this, and it's exciting to see so much engagement, and I know there are a ton of questions, and we are happy to help provide clarification and answers for folks. So don't be shy about going to our website or shooting us an email at healthimpactproject@pewtrust.org, and we can take it from there. But looking forward to continuing the conversation at a later time. And I think Sarah's going to take over now, right? In terms of the slides? Great.
Yes. Yes, can you all see the screen about the appropriation?
Yes.
Okay, great. Dave, do you want to start us off in this subject?
Sure. So basically, we wanted to update folks on where things are at with regard to appropriations work. In previous calls, we've discussed this at length. We want to focus on CDC, HUD, and EPA and where each of those three agencies stands, and also pose a couple of questions for consideration by the coalition. So this is sort of historically where things have stood for each of the three federal agencies going back to the year 2000. As you can see, it's kind of been up and down. Maybe I'm going to turn this over to Darcy, but let me just jump through these slides quickly so people have an overall sense, and then Darcy can tell us where things are at specifically. So next slide, Sarah. I guess I can't see this. Someday I'll learn how to. Okay, so this is basically where things are at with HUD. The House in FY18 proposed $100 million for the lead hazard control and lead demonstration programs, $30 million or $25 for healthy homes, and $5 for technical studies. The Senate increased that a little bit. So that's, I mentioned some good news. That's a piece of the good news. So we're up to $160 million. The request of the coalition stands at $230 million. But this request, I would point out, is tentative. The coalition needs to, in my view anyway, act to figure out exactly what our ask should be. Next slide. So this is where the HUD thing has been. As you can see, it's not up to where it needs to be. The high water mark was about $176 million. The House provided some, and the Senate has increased that further. So it's going to be important in the coming months to make sure that the Senate number stays in there as the government proceeds, or the Congress proceeds with its appropriations work. Next slide. At CDC, our coalition request tentatively is at $50 million. As many of you know, both the Senate and the House stand at $17 million. For asthma, they're at $29 million, and the Environmental Tracking Network stands at $34 million in the Senate and $25 million in the House. Coalition does not have a specific request at this time for asthma and the tracking network, so that's something that we think should be put on our agenda for discussion. Okay, next slide. And many of you know that it's really been through the work of the coalition and lots of other allies. You may remember back in 2012, the CDC took a huge hit to the lead program. We've kind of clawed our way back, but we still are way below where it needs to be, especially if we expect surveillance to continue in all 50 states, which needs to be, again, around 50 million. Next slide. At EPA, this is sort of the most difficult one. We do not have a specific coalition request. Tentatively for the categorical grants for lead, some of us are suggesting 15 million. The House has provided 14 million. The President's budget, I would note, has completely wiped out the lead categorical grants, as well as if you look at the table below that, the lead risk reduction program has taken another huge hit, which will basically not even be enough to keep the lights on. So the EPA budget is in the most dire circumstance, and I and a number of others have testified before EPA to try and reverse the President's budget. Next slide. So that's where things stand at EPA. You can see that 2018, unlike CDC and HUD, where the numbers look, at least reasonable, at EPA they're in pretty tough shape. Next slide. I think that's the last one, right?
That's it.
Okay, so Darcy, take it away. We only have, I guess, 7 minutes left, but tell us where we're at sort of tactically on the Hill.
Can folks hear my voice?
Yes.
Yep.
Oh, good. Whew. I was having a little technical difficulty earlier. Thanks, everyone, for joining the call. I think that most people probably listen to enough nightly news or whatnot to know that we have gone with a continuing resolution at this point that takes us into early December. So all the funding of the agencies that we are concerned about and are engaged with are still at their 2017 level. We know that the President offered a budget earlier this year that was not very detailed and set some numbers significantly lower, including in agencies where he has basically requested them to figure out what kind of cuts they want to provide for themselves. And their agency heads going through that process, and that's why Dave mentioned testifying, and he has gone in many cases to these agencies as they did their own form of self-review and talked about what the money does in our particular buckets to help prevent different kinds of lead and other healthy homes issues, bad things from happening. So as we look forward, what has happened is that the House and the Senate have not been terribly concerned about the President's budget and the numbers that he offered, and the appropriators in both the House and the Senate have gone ahead and set their own levels and done their own form of budgeting. Since they do not actually have any kind of a budget agreement, there's no no blueprint for what would be expected as a whole level of spending, and each appropriations committee has put in their own numbers. So I think the interesting thing has been that despite the rhetoric from the White House about how much cutting is going to happen, the House and Senate, who are actually the folks who decide how money gets spent, are going their own way. And in most of the areas that you see as a priority, they are sticking with at least level funding, and in some cases, a little bit of funding above that. I'm sad to say that probably part of the reason for that is because your issues are in the headlines right now because bad things are happening. And so that often sometimes has good outcomes in terms of funding, but it's sad that that's what it takes to make that happen. We will probably end up with a 2018 budget that comes from an agreement that will happen in December that will roll in a whole bunch of different kinds of issues, but we are expecting that most of the numbers that the House and Senate are proposing, they'll have to agree. They have to do something called a conference where they get together and talk about the numbers. So there might be a few pieces of pie that get sliced in the middle, but there will definitely be very little chance that the numbers will go below anything that the House requested. They will be at least what the House requests and potentially up to what the Senate requests. We have folks who are part of the coalition who've been going in August and September to their home district offices to have meetings with appropriators. And one of our main messages in those meetings has been, please appropriate or please conference and have the final numbers be at the Senate level because they're the more generous level. And so we will continue on that path. And, you know, it'll be interesting to see whether the Office of Management and Budget does a different form of budget next year once they've been in office for a year, so have a little bit more time to fine-tune their process and dig down a little further. But at this point, it looks like the House and the Senate are going their own way, and for you all, that's an advantage.
So I think the conclusion is that it's critical that people reach out to their members and make it clear that that we do not want the president's budget request. We want the coalition asked to be enacted, and this a lot of activity is going to occur between now and I guess December, when hopefully there's a final budget resolution of some kind. So the time is now. Use the state fact sheets. Try to schedule meetings with your members. Talk to Sarah or Darcy or me if you set up a meeting, and we'll do what we can to be of assistance. And use the Pew report. I mean, the Pew report doesn't contain any recommendations about appropriation, so that's important to note. But I think obviously the fact that the cost-benefit ratios are all positive shows that we need to make further efforts. Darcy, you want to add anything further in terms of what people should do specifically right now in the next or so?
Yeah, I would definitely say we're cranking out fact sheets for each state as fast as we can. And so if you have an opportunity and have decided you want to go visit your office back home in district or have a regular contact with your House or Senate offices here in DC and would like to send that fact sheet and you don't see your state up there yet, please let Sarah know, because we can turn them around pretty quickly. And we would really love people to continue to push the message that we would like to see the spending levels at what the Senate is offering. And I mean, I wouldn't even mention the president's budget.
Okay, I stand corrected then. Are there any comments or questions? We have a couple minutes. Well, I guess we're down to the last minute here, but on the appropriations issues, Sarah, I can't read the messages, but maybe you can.
Yeah, let me just take a look. I don't know if there are any questions on the appropriations in particular. I would say that we'll be sending, the webinar has been recorded, so we'll send recordings to people, and we can also send the information about the state fact sheets and other resources in a follow-up email to everybody, so everyone has that.
Okay, and then we'll take a look at the questions that we didn't get to, and we'll reach out to people on whether we want to have another webinar where we can go through some of the questions that we didn't get to. So thanks everyone for attending. We've gone through a lot of material this last hour, and we look forward to ongoing discussions and action to address the problem. So thank you all for coming. Bye-bye.
Thanks, everybody.
Bye-bye.